I would like to tell providers the opportunities and growth of the structural heart program at the University of Minnesota and UMP Heart. We are excited. There's been such an expansive growth of this area. There's really been nothing like it since coronary stents came out. Starting off with our TAVR program, or transcatheter aortic valve program, which treats aortic valve patients. And when we began this about 5 to 6 years ago, we were just treating patients who were really prohibitive risk for open heart surgery. Today that technology has progressed so that it is now approved for use for not only high risk but intermediate risk patients, and we're currently involved with trials at the university with low risk patients. So really any patients now of yours that have aortic valve disease should be considered to be seen by our valve clinic and evaluated in a multidisciplinary setting for what may be best for your patient, be it a catheter-based approach to the aortic valve disease or open surgery. It could all be considered through the one valve clinic. Then expanding on from that, we have mitral percutaneous therapy as well for people with a leaky mitral valve when a structural abnormality of the mitral valve, such as a prolapse or a torn chordae. We can now repair that through a percutaneous approach with a small incision from the groin as well. These are done on the completely beating heart. They don't need to undergo cardiopulmonary bypass. They're minimally invasive, and they're typically home within a couple of days. Extending beyond that, we have typical, of course, atrial septal defect, ASD closures, VSD closures, but what's new and exciting as well is treatment of the left atrial appendage for those who are at risk for stroke. Atrial fibrillation is a huge problem, as you know, out there affecting millions of our patients in the United States. And unfortunately, a lot of the patients are older and are unable to go on blood thinners to help decrease the risk of stroke, and therefore they just aren't adequately covered and prevented for stroke prevention. What's now approved for use in the United States, and which we currently have, is the Watchman device, which is a left atrial appendage occluder, which can occlude the left atrial appendage, and therefore the patient doesn't need to be on long-term oral anticoagulation. So we're really excited about that as well. While we all think of coronary stents and coronary artery disease being minimally treatable and incredibly popular out there in our patient population, I think what's now coming increasingly aware of and being able to be treated via a less invasive approach is the world of structural heart disease, which involves all heart defects which are not involving the coronary artery. So be it any valve, aortic valve, mitral valve, and we're even working on a recently approved valve now in the pulmonic space and therapy for the tricuspid as well, you have to really consider referral to a structural heart clinic. New devices such as appendage closure, ASD closures, those are also available. So we're happy to see that your patients as necessary and offer them whatever may best suit their needs.